Joining us now is a senator from Michigan's 8th District who recently sponsored a bill that would hopefully lead to some changes in that regard. Joining us on the MegaCast now is Senator Peter Lucido from Michigan's 8th District. Senator Lucido, thank you for being with us today.
Yeah, good afternoon. And Tyler, Ronnie, thank you for having me on the program today.
Well, thank you for being with us. Just full disclosure for our audience listening, my father, Tim Kieft, and Peter Lucido were fraternity brothers at Oakland University, so there is some history there, but make no buts about it. We're not going to let that at all impact our conversation today. We're going to have a nice conversation about COVID-19. So, Senator Lucido, how are you? How's your team been doing?
Everybody's doing great. You know, it's challenging times at the Capitol. We have to wear masks when we're in the Senate. And when we're doing Senate business, we have to wear masks in our office, anything inside. It's great to get outside when the weather's nice because you take the mask off and breathe a lot differently. But everybody's wearing masks, social distancing, doing everything they can, washing their hands countlessly is the word. And at the end of the day, we still have to do the work of the people.
Absolutely. And it's good to hear that's going on in your office. And we've heard that similar from other senatorial and representative offices as well, and everyone's doing their part. And I think that's what we're seeing now is that Michigan is taking this seriously, whether you agree with the decisions that have been made or not. We understand that this is something we have to work together on, and we can argue about down the road after we're through this. But for now, we have to focus on keeping each other safe. And it's good to be seeing that there's some cooperation, even at least on the base level, between people on all walks of life in Michigan and on all sides of the aisle.
Yep.
So Peter, you recently sponsored a bill that passed in the Senate 24-13 with some Democratic support even as well that would change the dynamic in terms of COVID-19 patients being placed in nursing homes. Hindsight's 2020. We clearly know that's been a problem. What will this bill, should it pass the House and be signed into law later on, fix in regards to that problem?
Tyler, let's look at history first. We learned about COVID when Dr. Calhoun and our governor came out and said, we have a virus that's hit Michigan. This was back in February, and we have to know how to deal with it. It was late February. And then March 13th, HCAM, which is the Healthcare Association of Michigan, HCAM, that's the acronym, came out and said it actually affects elderly patients and people more that are susceptible to all of the things that Dr. Calhoun said: high blood pressure, hypertension, diabetes, elderly who have what's called compromised immune syndrome. Their systems themselves are shutting down as you get older. Your parts don't work the way they used to when you were younger, and your immune system doesn't fight off diseases quick enough. So what Dr. Calhoun said is we want to be especially attentive to those individuals. We have about 430 nursing care facilities throughout the state. LARA, Licensing Bureau, goes ahead and takes care of the licensing for nursing homes. And the DHHS, which is the Department of Health and Human Services, takes care of the protocol and policy of how we are going to stay healthy in Michigan, which means how those seniors are going to be cared for, the policy involved with what structurally needs to be done. And they have the largest budget of the state. They have about $28.5 billion with a B dollars. That's a lot of money. Mm-hmm. As a result, there was a recommendation on March 13th in a memo to the governor, which LARA and DHHS were both copied on, that said, we would like to set up facilities that are, one, either not licensed yet, or two, that are thinly being occupied, and get those individuals that are coming out of hospitals that have COVID into those facilities, keeping and protecting our most beloved population, our seniors, free from people with COVID. The reason why, Governor, is one, we don't have the PPE. We're fighting with the hospitals for this, meaning they're giving it to the hospitals first. Two, we don't have the proper medical care and assistance. We have what's called personal care workers that come and do things for the nursing care facilities that are changing their diapers, washing them, clothing them, wheeling them down to the cafeteria to eat, and wheeling them back to their room. If we go ahead and have COVID patients inside of our facility, we don't have the ability to separate them perfectly as the rules require, because we have the same HVAC system with a cold air return, which is going to push a virus that's airborne all around the facility. And lastly, Governor, we really just don't have this thing set up properly for having this done. In February, we learned about it. In March, the HCAM society that looks over this medically, legally, everything said we can't do this. But yet the governor in April 15th was her first order that said, if your facilities are 80% or less occupied, then you must take COVID patients. Because there's a non-discriminatory practice in the law that says if you're catching Medicaid dollars and Medicare dollars, you can't discriminate. Well, I want everybody to realize that there was only 4 other states that were doing this, okay? And that's it. And those states have since changed their policy, but we'll get into that in a minute. As a result, we noticed the death count going up extremely high in nursing facilities. In fact, the ones that are around me, and I don't want to name them because of business purposes, who was actually following the letter of the order of the governor, stated unequivocally, we've got 27 deaths over here and we don't know what's going on. It was simple. The care workers were not trained and skilled to take care of the COVID. In addition, the care workers didn't have the proper PPE from the beginning, because what they did was they had to use the same PPE for the entire day or day in and day out. Therefore, they were moving from one part of the facility to another part of the facility, taking care of COVID and non-COVID, because there was no other help, and they weren't following the guidelines. The last thing is this. We learned that the second order that the governor had indicated never was changed. We were still doing the same thing over and over, even though the death rates were going up in nursing facilities. And at the end of the day, I said, this is out of control. Why? Loved ones were calling me saying, my mom's in jeopardy. I can't get in there because the order said nobody in except the workers, nobody out, can't bring mom out for the weekend. And you can't even talk to them through an open window, even right now today. I mean, you can see people in jail easier than you can in a nursing facility. But that being said, let's talk about where we're at. She now is going to have testing for people coming in and out. That's great. But the people inside are the ones that get the infection. And they're going to test these elderly people sticking a Q-tip up their nose. It's about 4.5 to 5 inches long, all the way up into their frontal cavities up here. I don't think that that's proper. I think what we needed to do, and Senate Bill 956, Senate Bill 956, yes. You can read it on the web. You will see that the Senate bill says no more COVID mixed with non-COVID. If they're living in the facility and that's their known address. So if I'm living already at a nursing facility, then DHHS, as well as LARA, the licensing and the healthcare policy, come out to the facility to see whether or not their inspectors will, because they didn't come out last time when this all started, whether or not they can be separate, that the care workers are going to be separate. They're not going to be the same working back and forth in the units, whether there's medical personnel, whether there's proper PPE, ensuring the public that the lives of those that are going to be inside are not going to be at risk. And anybody that's discharged from the hospital that doesn't stay in a nursing facility will not go to a nursing facility. Why? Why should we bring in more infection into a place that already has compromised immune syndrome? So therefore, it's a basic right that you have a right to live in the same place that you have. And that was some argument that one of the senators had on the other side of the aisle and said, you're taking away their right to live where they want to live. No, I'm not. If they don't have the proper PPE and everything, I'm saving their lives. I'm actually giving them a chance to live and letting the other ones live too. Because if that facility doesn't have proper care for that elderly, we're going to get that elderly to a proper care facility that's designated as a nursing facility for COVID only.
So
We're going
Senator,
to protect those.
so
Wait
Sen-
a second. We're going to
okay.
protect those inside the home that don't have COVID, so they don't get COVID. Go ahead.
So Senator Lucido, in that case, does this bill establish a precedent for certain facilities where these patients would then go? And forgetting nursing homes in this equation, they're not going to be going there anymore under this bill. Where is that determined place that they go next once they're out of the hospital, so that they can continue to be put in a safe situation and keep the public safe without, of course, as you've mentioned, putting nursing home patients at risk?
Perfect. Great question. And here's the answer. The governor tried to establish the TCF, cost us millions and millions of dollars, cost us the National Guard to set up all this. They were staying at the greatest hotels downtown, and they deserve it because they were working around the clock to establish 1,000 beds at TCF, the old Coble Hall, and have all this protocol. We never really used that. It cost us millions of dollars. The money was thrown in the toilet. In addition, Novi Expo was set up. We never used that. When I say never used it, there was a few patients in there. They knew that this wasn't going to work. So they continually and routinely and systematically discharged people from the hospital that weren't qualified for hospital care to go into a nursing facility. Now, the governor sweetened the pot by saying, I'm going to make $5,000 available to any nursing home that's 80% or occupied or less. I'm going to give you $200 extra per day when the person actually is using what has COVID, the nursing facility, plus pay you your monthly stipend of whatever you're charging. And if it's Medicaid, Medicare, or private pay, it didn't matter. You're going to get the monthly stipend. You're going to get $200 a day for a bed, and you're going to get $5,000 to have beds available for us to do this. That's a sweetener of money. It's a motivation. I've learned recently the federal government did a complete analysis and evaluation of the nursing homes by way of 5-star. There was a few 5 stars. The 5 stars were occupied 100%. Because when people know it's a good nursing home, that's where they want to put their loved one. The ones that have 1.5 to 2 stars is where these regional hubs, they call them, were set up by the governor, where the nursing care facilities took in these patients that were COVID affected and affecting everybody in there. So they were already low on the totem pole, which meant people either didn't go to those facilities for unbeknown reasons. It could have been improper care, blah, 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 blah. They were already deficient to begin with. So in the future, HCAM, who is the healthcare for elderly of nursing homes, should had the governor sit down with them and said, since we can't do it there to you, and they gave a recommendation. They're saying use the homes that are not licensed. Use the ones that are going to be in the queue to get licensed. Let's set that up. Let Lara come out and let's establish facilities, 8 of them regional within the whole state of Michigan. You know, a lot down in Southeast Michigan because we have almost half the population. Let's do it down here. We also had a hospital in Wayne. Beaumont Hospital closed and laid off 4,000 workers that were skilled, that we could have used the Beaumont Hospital as a regional hub in and of itself to take care of nothing but COVID. There was proper medical people. There was proper facility. There was proper HVAC that didn't affect the virus in the air and moving from room to room. And there was proper protocol in the hospital. You can't do it any better. It would have been a perfect setting since you weren't using TCF down at Old Coble Hall or Novi Expo. Why wasn't that an option or alternative? Now we have to subpoena from the governor and says this. My daughter worked at the CDC, and I'm proud of her and her accomplishments. She went to school down in Georgia to get her master's in public health. And then she moved on and went to the World Health Organization. I asked her to look at where I can find the guidelines that talked about that they were following from the CDC that says you can put COVID in to non-COVID facilities. I still ask Dr. Caldoun, please share with us. So, you talk about science, you talk about data. Show us the science, show us the data. Let me see, because the doctor that I had come and testify on the Senate Bill 956, the doctor said there is no such protocol. The doctor said her mother's in a nursing facility in Canada, and to the point, she said that is the worst thing you can do is put infected patients into a vulnerable, most tragic situation by allowing still these workers to cross paths and cross-infect these patients. So I'd like to see the data. I'd like to see this research and CDC guidelines that they're all talking about, because I'm from a place where you show me the details and the results, and I'll believe you. Until I see it, I don't believe any of this.
It's a topic you're very, very passionate about, obviously. So this goes to the House next for a vote?
Ronnie, it does. And I got to tell you, yes, I'm passionate. My dad was in a nursing facility, and I learned a lot for 2 months to nurse him back to care. My family, because I come from 8 children, mom and dad make 10. So we grew up in a big Italian family. We literally moved his whole living room into the nursing facility to make it feel like home for Dad while he was nursing himself back. He died at 96, but for the 2 months that he was in the nursing facility, until we took him out and brought him home because we didn't want him there anymore, we saw the challenges that these personal care providers have. And as a result, we wanted to make sure and ensure that we were there giving my father tender, loving care till the day he said goodbye, because he took care of us when we were kids. My mom's 91, still alive. And she said, son, this is not right. This doesn't make sense. And I kind of agree with my mom. And she said, whatever you have to do, make it right for the seniors. They're the greatest generation that ever lived. Do it. At the end of the day, I had Democrats on board on this. You should, because people are people. They're not political. This is not political. This is about conserving resources that will do the best job for the people at the time they need it most. It's also ensuring the safety and security of loved ones and their family. And yes, it's going to pass the House. And yes, it's going to get on the governor's desk. And I kind of feel that, you know what, Governor? Try something different. You know what? Try something different than just the testing. Ensure the public that you're going to be safe with their loved ones. Because what you're doing now, the tension and the frustration and the calls coming to my office, I know I'm doing the right thing when they said, keep going, Pete. Lucido, go give that bill to the governor and let her sign it.
Senator Pete Lucido with us on the Oakland County Megacast. Thank you for joining us today, giving us some insight on the Senate Bill 956 that is now going to go to the House of Representatives. We appreciate you having on, and I'll say hi to my dad for you as well. Thank you for being with us.
You know what? Tell him we're Theta Chi's through and through, but you know what? We're brothers, ultimately in the end. But you know what? Let's take care of the greatest generation, because God bless that generation who's taught us how to live in a better world.
Absolutely. Thank you very much. Senator Pete Lucido with us on the Oakland County Megacast on our family of TV and radio stations all throughout the Oakland County area.